Yeah, please come in. Come in. Hello? Sure. Yeah, please come in. It's alright. You're exactly on time. So that's perfect. Thank you. Well, first, it's really amazing that you are so responsible with your health and you have regular appointments with doctor. And then the second thing is that you are always on time. So you're one of our most punctual patients, to be honest. Sure, we do respect that. Well, anyway, please take your seat. I guess the one here in front of me would be perfect. Yes, right. Do you feel comfortable there? Can I get you anything? Maybe you'd like some water or something? How are you feeling today? Okay. Yeah, well, is there anything you'd like to tell me? Maybe something related to your health issues or the way you feel? How do you usually feel in the mornings? Is it easy for you to wake up actually? Well, it's pretty common. And how many hours of sleep do you usually have, may I ask? Oh, I mean, you could definitely do better. So, I do believe that you can try to find some spare time to add it to your sleep a little bit. Yeah, at least half an hour. That would be great. But yeah, I get it. So life can be so unpredictable and stressful sometimes. So, but just try to do your best to get as much sleep as you can. It's really crucial for your health. Sometimes we really underestimate how important the sleep is to our health, to the way we feel, our general well-being. So please do pay attention to that. Yeah, that would be great. Well, and then what about your head and neck? Do you ever have any kind of ache or pain in these areas? What about the area around your eyes? We're gonna inspect it in more detail, more thoroughly, but like just if there's something you could let me know right away, that would be great. Okay, okay, good. Well, what about your muscles? Do you ever have any muscle sores, especially when it's not caused by exercising or something? Okay, yeah. And any cramps in your muscles? Again, the ones that are just unexpected and not could not be explained by exercise and working out and stuff. Okay. And how often do you usually exercise? What kind of workouts do you prefer? All right. Well, great. That sounds good. Yeah, any kind of physical activity would be good for you, and any kind of physical activity would definitely be better than nothing. So that's for sure. Whatever you like, go for it. No matter if it's swimming, dancing, actual weightlifting and stuff. Yeah, so Pilates, whatever, really. Just try to move that body as much as possible, because the sedentary lifestyles and all the stuff is, yeah, it's kind of bad for our health, for our system, for our spine, back, and like the rest of our body. So very often these headaches can be caused by the wrong position of your neck, yeah, while we are sitting and stuff. So yeah, it all can be so interrelated, so that sometimes you would wonder how it can be connected that way, but and yet it works, right? So anyway, any other complaints I should know about? I will ask you some more questions in the process, okay? Yeah. So I guess that if there are no other questions you would like to ask me, we could start. Great. I would just want to confirm your email. Could you please remind it to me? Right. Right. And your phone number, has it changed since your previous visit? The previous appointment in our clinic? Not really? Could you just... Okay, I'd like to confirm it. Sure. Oh yeah, that's the one we have. Okay, wonderful. So I guess if you're ready, I'm always ready, so we could start. Right. Well, I will put on my gloves first, and there's really a lot of stuff I would like to test today. I would like to check all your cranial nerves, how they work, and how they function, and if there is anything we need to pay special attention to, right? So I guess that would be really great, just to test everything. And like I said, once again, it is really, really amazing that you are so responsible when it comes to your health, and that you make these appointments regularly, on a regular basis. So it's always better to diagnose something while it's still on this initial stage, right? So, well, I do hope that everything is totally fine with you, but just, you know, like, theoretically, it's always better to prevent something than to try to treat it when it's already there. Anyway, so I put on my gloves for a reason. I'm gonna touch your face really slightly, if you don't mind, of course. Thank you. Well, and I will just see how your muscles work, if you can actually recreate different facial expressions. And I will also inspect the area around your eyes, and probably right away we'll have a brief look at your nose, at your throat, at your mouth cavity, your neck, thyroid, and other stuff, right? So everything I can inspect with my hands surrounding like your face and your neck and stuff. Okay? Okay, great. Well, I will lean towards you a little bit, just in case you feel uncomfortable or something hurts, you can feel some kind of ache or pain. Please do let me know, okay? I hope so. Okay, so don't hesitate, right? I won't be offended. I won't be upset. We'll just be able to change something in case you feel uncomfortable, because your comfort is like really important to us, right? Okay, good. Well, just relax. It's fine, it's all right. No worries. Okay. Is it all right when I press here above your eyebrows? Good. What about below your eyes, your lower eyelid? Wonderful. Now close your eyes for a moment, please. Open your eyes, please, and blink. Good job. Okay, so the blink reflex just working fine. Okay, blink. Good. Okay, wonderful. So no unexpected actions. I promise. Okay, good. Any more, at least. Okay, so now let me have a look. What if I press here around your cheekbones? How does it feel? And there, right on your chin. Okay, fine. Now your neck and your thyroid. Okay, good. Now please let me have a look at your ears. Good job. Okay, so now would you please smile at me? Let's start with a smile. Okay, beautiful. Thank you. Now, would you please frown at me? Raise your eyebrows. Give me that surprised face. Okay, great. Now, please open your mouth once again. And now close it tight, and keep it tightly that way. Clench your jaws. Don't let me open this lower jaw. Don't let me just like put it lower, okay? So just clench your teeth, clench your jaws. Exactly. Wonderful. Great. Now puff your cheeks, please. Hold there. I'll try to close them, okay? Don't let me do that, okay? Please keep them puffed this way. Okay, wonderful. Thank you. So now you can relax. Okay, great. Now, would you please shrug your shoulders? Now I put my hands on your shoulders. I'm trying to put them down again, and you try to resist me and raise them, like shrug them, okay? Wonderful. All right, good. And now please shrug them, and once again put them in this highest position possible. And again, I will try to put them down. Don't let me do that. Just keep them this way. Exactly. Okay, so would you please put your arms this way? I will try to once again separate them. Yeah, put them apart. Don't let me do that. Just keep them this way. Yeah, okay. So don't let me like push them further, okay, to the sides. Good. Okay, wonderful, amazing. And now would you please tilt your head so that it would like you would reach your shoulder with your ear, like more or less. Okay, wonderful. Now I put my hand on your head, so please try to raise your head back to normal, to straight position. Okay, great. And now let's do the same thing to the other side, right? Just like that. Okay, great. And now once again try to resist me and try to pull your head back to normal position. Okay, amazing. Thank you. Well, you're doing so good so far. So yeah, I don't see any problems with that, with your like reactions, with your muscle movements and stuff. So it seems like, yeah, your face and everything is working just fine. Okay, now since I'm already inspecting your face, let me have a closer look at your mouth, in your throat. Okay, so later we'll go back to them a little bit, but for now let's just do it. I'll put the spatula on your tongue, okay? So open your mouth. You don't need to stick out your tongue for now, okay? So say ah. Okay, wonderful. Now stick out your tongue and say ah once again. Okay, great. Now you can put your tongue back to your mouth cavity. And now I will try to put it to the side. Okay, great. And now to the other one. Wonderful, good. Now could you please raise your tongue to your palate, please? Exactly. Okay, amazing. Now let me have a look with this light for a moment. Just a moment. Okay, so the throat seems to be just all right. Uvula, the palate seems healthy. Okay, everything, it looks just fine inside your mouth and in your throat. When was the last time you had some kind of a cold, a sore throat, cough? Okay, got it. Right, so now let me have a look at your nose, okay? You simply need to put your chin up just a tiny little bit so that I can see your nostrils, okay? So it's not gonna hurt or something, I promise. So I'll put the mirror close to it and let's do it this way. All right, good. And now to the other one. Right. Yeah. Okay. Okay, now your ears, right? So let me have a closer look at this one. Okay, everything seems all right. Have you experienced any troubles with hearing lately? Now to this side. Good. Yeah, it's just fine. Well, at least your ear canal looks all right. And the amount of earwax is not like higher, like bigger than it's supposed to be. So everything seems just fine, like visually. And then we'll inspect your hearing a little bit more thoroughly. We'll do some hearing tests, some like kind of an ear exam, so don't worry about that. But for now, everything looks just fine. Okay, well, since we started inspecting your ears, I suggest that we actually do this hearing exam right away, right? So, and then later we'll check your olfactory nerve and do your eye exam and stuff like that, right? So no worries, we'll do everything. The order doesn't really matter that much. So do you know what it is? What does it look like to you? Tune and fork, right? Yeah. Okay, so I suppose you might already know how it works. Do I need to explain it to you once again? Just a quick reminder, okay? So I will put it right behind your ear like that, and you will just listen to this sound vibration. You'll feel it, and you simply let me know when it's gone, okay? When it stops, when you don't hear it anymore. Then we'll do the same thing with the other ear. Then I'm gonna put it on top of your head, okay? So, and you'll just let me know if you can feel and hear like the sound and vibration symmetrically on both sides, right? Okay, so let's start with these tests, and then we may do a few more like thorough tests to just examine your hearing on a more profound level, okay? Okay, great. Well, now let's do it. So I'm putting it behind your ear, okay? Are you ready? It's fine. It's not gonna hurt. It's not gonna be too loud. No worries, okay? So good. Okay, so you can't hear the sound anymore. Wonderful. Now the same thing, but with the other ear, okay? Okay, so nothing. Good. Now on top of your head, okay? So you cannot hear the sound anymore. What about how symmetrical was this? How symmetric was it on both sides? Maybe you could hear it better with one ear. It was pretty much the same on both. Okay, got it. Good. Yeah, that's great. Well, sometimes when we have really extensive hearing test, ear exam, we can also try different kinds of tuning forks with like different pitch and frequency and stuff. So I guess that today doesn't really make that much of a sense. So what I have already saw, or what I've already seen, is actually more than enough for now, or at least with this device, with tune and fork. And then when you come for your actual hearing test, for your ear exam, yeah, we'll do it in a more like detailed way, more profound level, okay? Okay, so that will do. I promise. For now, it's like more than enough. Okay, but just let me type in the results, okay? Good. Oh, you're doing great. Like I said, there's nothing to worry about. Okay, well now let's add a little bit more, a few more exercises for you to test your hearing. So I will just create some background noise with my latex gloves. They are perfect fit for that. And I will just whisper some words, phrases, whatever to you, and you let me know what you heard, okay? Please don't be afraid to make mistake. It's totally fine. Even if you say something wrong, even if you hear something wrong, it's not a catastrophe, it's not a big deal. That would be all right. So there is some percent of, wrong answers that can be acceptable, that there can be still a variation of what is considered to be normal, okay? So no worries about that. Just tell me straight away what you heard, no matter how weird it might sound or whatever, okay? Okay, great. So are you ready? Good. White freesia. Exactly, it's one of my favorite kind of flowers. Okay, amazing. Now, apricot tree. Good job. Doing good. Okay. Now, polar lights. Good. Wonderful. Now, red hair. Red hair. Great. Okay. Now, dazzling. And the light can be. Okay, great. Keyboard. No, okay, wonderful. Now please close your eyes for a moment and let me know how many snaps you've heard, okay? Good. And now? And now? Wonderful. And what about now? Okay, good. Now let me know if all the snaps were like with the same rhythm, homogeneous, or if there were some like longer pauses between some of them, okay? Okay, so for the last one there was longer pause break. Okay, wonderful. Good. Now there were 2 and then 3 more, a little bit faster. Okay, wonderful, amazing, good. And now, okay, 1 and then 1, 2, 3. Okay, great, amazing. So not only you have good hearing, but your memory is also just fine. Okay, that's great. Well, now please let me know which side the snaps were on, okay? Which ear they were closer to, which ear. And once again, that would be cool if you close your eyes to avoid cheating and just so that not to turn it into your eye exam, okay? Good. So have you closed your eyes? No cheating. Wonderful. Good. Just tell me which side the sound is on, okay? Okay, wonderful. Good. And what about now? Great. And now? And now? Still the same one. Great. And now? Okay, wonderful. Thank you. So your hearing is totally fine. You did great, even with this challenging test with whispering words. So I know sometimes it can be hard to guess the word, but you just nailed it, my friend. So great. Wonderful. Well, now, since I have the stethoscope right on my shoulders, let's use it. Oops. I'm so sorry. Didn't expect it to be that way. Okay. Excuse me. Well, anyway, I'll just bring this thing close to your skin on your chest and on your back. So it might be a little bit cold, but I hope it will be bearable, okay? So pull up your shirt a little bit. Now that will do. I will do. Wonderful, thank you. So I'll give you some instructions, okay? I'll tell you what to do. Okay. Good. So, okay, would you please press in? Good. Now once again, press in and press out right away. Okay, great. Now press in again. Hold there for a moment. Okay, press out. Now turn your back. Now once again, press in. Press out. And once again, in. Good job. Once again, press in. Please hold your breath. Okay, now you can exhale. Good, now let me listen to your heart. Okay, wonderful. Well, everything is just fine. So, no need to worry about anything. And your heart is beating evenly, so like your pulse, everything is all right, and your breathing is also very clear. I don't hear any like excessive redundant sounds there, so yeah, everything is just all right. I'll just put in the result, this test. Yeah, we're just trying to include everything possible in this kind of exam. I mean, of course, everything that is related to your cranial nerves, to your health, but still, it is really cool when we have enough time to do it really thoroughly, right? So it's really important to us to not to be in a rush, not to hurry, but just like to do it the way it should be done. Okay, so great. Well, thank you. Now I guess we'll test your olfactory nerve. How does that sound to you? Usually these are the most fun tests, I suppose, because we can use all these possible kinds of testers to see if your sense of smell and your sense of taste are working well. So it can be a little bit of fun, you know, when you smell something, when you taste something and try to guess the flavor. So it can be fun, right? Well, I'll take this cotton swab and I'll just put some tester onto it. First we'll test the sense of smell, okay? So okay, good. Okay, good. Well, now please take a small. Okay, was that enough? Just let me know. I can add some more. Okay. Good. Okay, wonderful. Right, yeah. Great. So it's actually well, actually it's like the herbal mixture of sage and a little bit of thyme and a little bit of like rosemary, but whatever you say, like all these kind of like herbs, like herbal smell, that would be the right answer. Yeah, so sometimes we can take this like mono scents, something, you know, like cinnamon or orange separately and stuff, but at some point, yeah, we can do more advanced tests with these like mixed weird smells. So, and I believe that herbal smell is not as like hard to distinguish, because I mean basically everybody knows what like the herbs smell like, yeah. So in this like general meaning. Okay, great. So now let's take another one. It might be a little bit more of simple test, but who knows? Let's see how it goes. Okay. Great. Well, now please take the smell. There's no worry. Don't worry. Take all the time you need. Okay. You're close. Yeah, it's some kind of like creams, some creamy stuff. So whatever you say, yeah, that would be right. It's like vanilla cream. Okay, so it smells of some kind of cake or an ice cream or something like that, right? Okay, great. Well, at least we had fun because, like I said, they can be some simple tests, but with some patients we can, just do something more entertaining, something a bit more amusing. Okay, now your your sense of taste. So I have a little bit of this substance in the syringe, so I will just put it onto your tongue. Yeah, just a few like droplets. Okay, so would you please stick out your tongue and good. So just try to taste it as much as you need. We can add some more if you wish. It's fine. Okay. Okay, just coffee it is. Good job. Okay, now I'll take another one. I believe we still have some. Yeah, this one. It's also based on this corn starchy syrup, and it is also like so this kind of like, it's just a clear transparent liquid, but it's really good because you don't have any hints like of the color. Yeah, because when you see green you might think of something of green color. When you see orange you would think that it's like orange obviously and stuff. So this one is actually clear and transparent, but it does have the taste. So are you ready? Stick out your tongue for a moment. Okay, so what does this taste like to you? It's definitely some fruit. Okay, agree. Peach, right here. Yes. Wonderful. Okay, well, at least it wasn't boring, right? I hope so. Okay, wonderful. So now let's, I guess, test your vision, your eyesight. I will just put in the results of this olfactory nerve exam. Like I said, there was no reason to worry at all. Good, one more second, and just have some rest. If you need, you can get some water. Right there. Yeah, exactly. So just take this paper cup and go ahead. It's fine. Okay. Good. How are you feeling? Are you tired yet? No? Good. Well, at least after this cranial nerve exam, you'll be able to get some good rest. And I'm pretty sure that being a little bit tired with all these tests, you will be able to sleep, like to fall asleep really, really quickly and easily. Now, vision. What can you see? So, it's a pencil. It is. What color is it? Okay, wonderful. Could you please follow the tip of this pencil for me? With your eyes only, please don't move your hand. No, don't move it. Just follow it with your eyes only. Good. Wonderful. So, now good. Right. Okay. Good. You know. No, that's fine. I was just checking your pupil reaction. Right. Your pupils react just fine. Yeah. No, they do not overreact. No. Oh, absolutely. Unlike you, my friend. Just kidding. Okay. Well, anyway, I'm thinking that we could actually proceed with your eye exam if you don't mind. And I will ask you to tell me if you can see any difference between these two lights. Please follow the warmer one with your eyes for me, okay? Good. Okay, which one is closer? But please don't look at the lights directly right now. Look at my nose, okay? If you don't mind. Yeah. Okay. Okay. Good. So, right, are you ready? Okay. Tell me which light is closer, warm or cold one? But don't look at the lights directly. Look at my nose, let's say. Okay, good. Good. Wonderful. Right, you are. Okay, amazing. Good job. Now, please tell me, keep on looking at my nose and tell me which side the light comes from. Right. Good. Exactly. Alrighty. Now, I'll lean a bit closer to you. Right. Good. Exactly. Good job. Okay. Okay. Now, please, could you count how many times the light appears and disappears, okay? But keep on concentrating on my nose here. What we're checking is called your peripheral sight or side vision, whatever you call it. Yeah. Exactly. So it's when you don't concentrate and focus exactly on the object, but can kind of see it. Yes. Exactly right, yeah. Okay. So look at my nose, please, and count how many times it appears and disappears. That was 3 times. Good. Three times again, okay. Twice, right. 4 times. Okay, right. Good. Wonderful, thank you. Now, what else is related to your vision? Actually, let's test your color blindness. Well, the fact that you named the color of the pencil right is already giving us some hope, right? So what color are my nails actually? Okay, good. Are they similar in color with the tip of this percussion hammer? Exactly, wonderful. Now I'll just take some markers, okay? That's alright. Do you feel bored? No. That's great. Okay. So what color is this? Good job. What about this one? And now what if I bring them closer together? Oh, you actually thought it was the same marker? No. So I was just like showing you the same one with the smart face of mine. Well, so can you see any difference in shades? Are they exactly the same to you? No, they are not. What is the difference between them? Which one is lighter, which is brighter, which one is more saturated, darker, lighter, and so on? Okay, fair enough. Yeah, that's quite alright. This color. Now I would just ask you to tell me if you can see any difference between these two. You have seen this one earlier, and this one, yeah, is relatively new. So, any difference? Which one is darker? Okay, which one is brighter? Good. Okay, no, that's just fine. Good. Right. And finally this one. Okay. Right, now please tell me any difference between these two. Okay. Thank you. Now that's good. What about these two? Are they similar in shades? Okay, wonderful. No, you're doing great actually. I'm telling you. These two. Anything similar? That's alright. Oh, no worries. You're doing just fine. Good job. Well, I guess that will do for your eye exam. Sure. Let me take some notes. Oh, that's good. Absolutely. No need to worry about anything at all. Okay. Oh, what is that? Think? And think once again. Good. Well, I didn't mean to scare you, I'm sorry. No. Your blink reflex works just fine, which is really, really good. Okay. Your sensation in your reflexes. You know what it is, right? So, the percussion hammer Let's start with your elbows, okay, if you don't mind. Good job. Great. Now your wrists. Wonderful. Now your knee jerk reflex. You know what to do. Yeah, please put one leg over the other one. Yeah, bend them in the knees. Good. Now would you please switch them? Great. And now closer to your heels, to your feet. Good. Okay, wonderful. So that's great. Your reflexes work just fine. Now your sensation. I have two instruments. Please don't be scared by this thing. It does have these sharp ends, but I'm not gonna press it too hard against your skin, so it's not gonna be too like painful or something. So what you're supposed to do is to close your eyes and tell me if the item touching your skin is soft or a little bit sharper, okay? So if it's sharp or dull. Good. Have you closed your eyes? Okay, great. It's a bit sharp. Okay. What about now? It's dull. Okay, great. What about now? Good. And now? Wonderful. What about now? And now? Okay. And what about now? And now? Okay, great. So 100% accurate. Amazing. Good. Now, a little bit more challenging. Thin. So, I have 3 different brushes. Okay? So, they are all a bit like different in their thickness and the density of this like fur like used and stuff. So what I want you to do is to let me know which brush is like striking against your skin. So what I'm gonna do now, I will let you try all of them. So let's start with this thin one, the smallest one, okay? Can you feel it? Yeah. So that's how it feels. Now this one, which is a bit bigger in size, yeah, and also like the middle one. So that will be a bit harder on your skin than this one, but still not as hard as the largest one. Okay, I mean the largest from the perspective of the thickness of this brush itself. Okay, so are you ready? Okay, so now you know what it feels like. And finally, the biggest one. Okay, so just close your eyes and try to feel it. Exactly this way. Okay, so now please tell me, just try to tell me which one of these 3 brushes you can feel now on your skin. Okay, okay, please close your eyes. Okay, wonderful. So it feels very light. Yeah, so this is the lightest one right here. What about now? Don't hurry with your conclusions, it's fine. Take your time to think. So this was this biggest one. Okay, great. And what about now? I mean, it's not necessarily, it doesn't mean that it will be this one. It can be any of these 2 again. So I will do it more than 3 times. So just, yeah, don't try to guess, but just really try to feel it on your skin. Okay, okay, good. So it was the lightest brush again. Okay, wonderful. And what about now? So that was the medium one. Okay, okay, good. And what about now? the biggest brush. Okay, great. Well, that's just amazing. In terms of color, which one is the darkest out of three of them? Okay, great, this one. Good. So I just was checking if you were very tired or not yet, not that much yet. Okay, great. Well, I guess that we have checked basically everything we were supposed to. Now just let me take your pulse, check your pulse, okay? So if it has changed in some way throughout the test, okay? And just if all these tasks were really overwhelming for you and how you're feeling now, okay? So give me a hand, please. Okay. Good. Oh, the pulse is just fine. Okay. Let me just put all this data in. Great. Okay, so like I said, I will finish the whole summary, the whole conclusion afterwards, but still for now I can tell you, I can say that you did it perfectly well, so everything was just excellent. No need to worry about anything, like I said. And thank you so much for your actually, it was so obvious, it was so easy to see that you were willing to perform at the highest level possible and that you were not sabotaging any tests and stuff. So I mean, people can be different sometimes and some patients can be really hard to work with, but you are one of my favorite, to be honest. One of my favorite ones. I mean, I'm not supposed to say it like as a doctor, but still as a human. Yeah, so thank you so much. That was a pleasure, and the time flies so fast when I'm with with the really cool patients like you. So once again, thank you. Yeah, we'll email you all the results, and just have a good one. Have some good rest. I hope you'll sleep really well today after all these tests. So, okay, great. So thank you. Thank you. I'll see you pretty soon. Yeah. Bye.